All right, you guys. So, long day with CAT scans, and today going back. So, CAT scans yesterday could be potential mass today. They did a stat reading on the CAT scan, and they think they see a mass. So, I went and had an ultrasound today to find out what it is or what it could possibly be. Um, of course, there's all the guessing as to after having a hysterectomy. So I had a total hysterectomy and then had one of my ovaries left in, which I thought at the time was a bad choice because it felt like it was giving me a lot of pain. But they reassured me that the ovary that I was complaining about was not the correct one. The other one was the one that should be removed. So they removed the other. However, still have had that pain since. I went back after my hysterectomy. And the reason being, at my age, they didn't want to introduce or force menopause, which we saw didn't work anyway. Um, because 2 weeks after the hysterectomy, even leaving the one ovary, which probably is because it's bad, um, something's wrong with it. I don't know. We'll see. We'll leave that alone until we figure it out, or until we have more results from the ultrasound. But the pain on my left side I've been complaining about for years. Um, Even when I lived in Georgia, I was trying to remember how far back I've been complaining about this. And going to the doctor and explaining, like, there's pain on my left side um, during intercourse, during walking, during whenever. It's almost like a simmering, brewing thing that kind of just lingers there. And of course, there's things that aggravate it: constipation, gas, sex, anything can really aggravate it. But it's just a little bit more complicated now that I have blood clots, and all the other surgeries and whatnot that I've had inside just make all of that area extremely sensitive. So we are now doing an ultrasound, or did an ultrasound today, to see what that means. So now I get to wait for the results on that. There's Birdie. I get to wait on the results on. It's so weird. I'm like rubbing right here, but I can't even stay focused because all I can think about is, I wonder what that smells like. Oh, it actually smells like coconut oil. Let's check both. Clean. Because they say it's the smell behind a baby's ears, and usually it's like, oh, geez. Mm, not good smell. The milk and stuff starts running, and they just, ugh. And they're on their back, and it just kind of gets funky, and sometimes people miss it. So for the baby that I just did that baby blessing on, my love, you know who you are. Make sure you get the back of the baby's ears. If your mama didn't tell you, get the back of the baby's ears. And thank you again for both of you. I know I don't know you personally, um, but I do know you watch these videos. So I appreciate you letting me be a part of your baby's blessing and entry into this world. I thank you so much for allowing that service to be as intimate and inclusive. I know that some of those practices are probably not some of your own, but allowing the baby to be exposed to them will take him far, far in the world. Getting blessings, I do more of a universal love blessing is what I call. Um, and this one in particular is a penny blessing for new babies. So thank you so much. I just truly appreciate it. I've been just vibing, literally. I mean, that's, I guess, where that word is coming in, the vibes. I've been vibing off of the vibrations from that ceremony uh, since I did it. I've literally called my best friends, my goddesses, and thanked them so much for being a part of it as well. And I just kind of shared you guys' response with them. So thank you, thank you, thank you. I look forward to being a part of his life in the future. And hopefully the bond between him and I will never disappear, and he will always be able to find me for any type of help, because that's who I am for people. So anything he can possibly need on a growing intellectual level, is definitely my part. If he gets in trouble, send him to me. If I'll be here until I'm not. So send him often. Shoot, we gotta cherish the day. But thank you guys so much for everything. Thanks for being with me through medical. It's 9 o'clock, so I have to run and take this shot, or I get to run and take this shot, man. And I could actually run if I really, really tried. So the fact that I've got a blood clot in the lung or in the chest and on the leg, and I can still run, I'm winning, like seriously winning. So thank you so much for everything. You guys take care.